We know that 30% of cancer incidence and mortality is related to modifiable lifestyle factors such as healthy eating and exercise and weight management. And while there's evidence for cancer prevention, there really isn't a lot of evidence for the role of nutrition and exercise during cancer treatment and how it may improve cancer treatment outcomes and survival. Another thing that's so interesting and what's really fueled our NIH funding is that patients don't adhere to the chemotherapy regimen that's prescribed to them by their oncologist. And so the trials that we're doing in breast, ovarian, and endometrial cancer are really looking at the role of nutrition and exercise during chemotherapy to see if it can improve the adherence to their chemotherapy regimen. And this is done by improving the toxicity to the chemotherapy, which in turn might improve their adherence. So I think that's a really important finding, because if we can improve their treatment outcomes, then this only improves their survival as well.
So what do you think some of the promising developments we've made so far in our research have been?
Yeah, so I think we've added to the literature as far as the mechanisms that are mediating the beneficial effect of exercise and healthy eating and weight management on cancer risk and prognosis. As you know, inflammation is a major mechanism, as is metabolism and immune function. And I think the randomized controlled trials we do that are really methodologically rigorous are allowing us to tease apart how much exercise and what do we need to eat, how much, how little, what to remove, what to add, to really impact those mechanisms to in turn improve cancer outcomes.
So Melinda, what is the ultimate outcome of the research that we're trying to do?
Well, ultimately, we want to see a continued reduction in cancer mortality rates and even a lower incidence of cancer. And we know, once again, that exercise, nutrition, and weight management is associated with about 30% incidence in mortality. And so I think for success, we need to take our findings from the research and incorporate it into standard of oncology care. What that looks like to me is that when a patient is diagnosed with cancer and they meet with the surgeon and the oncologist, they meet with the dietitian, they meet with the physical therapist. This is covered by insurance, it's available to all, and that it really helps them throughout their treatment and thereafter, and how to eat healthy during treatment, how to be more physically active, because we know that's going to improve their cancer outcomes.